Welcome to the 775 Alive podcast, your rural Nevada headquarters for decoding politics, economics, and general global shenanigans. I'm Crystal Newton, your business strategist, breaking down why Nevada's hustle is stronger than a sagebrush root in a windstorm. Here with my trusty co-host, Scott Gaborski, PhD historian, here to explain the smart lessons of history, even if we are likely to ignore them. Grab your boots for a wild ride through today's most important news. Scott and I are down in Las Vegas with Dr. Aury Nagy. There's so much to start with. You're an entrepreneur.
Sure.
You are a believer in freedom.
Absolutely.
You're running for office and a neurosurgeon.
That's true.
Is there anything? What am I missing? I cover it all.
We got a lot to talk about.
Yeah.
But you're running for CD3, right? Congressional District 3?
That's correct.
Okay.
Yeah, I'm running to unseat Susie Lee.
Okay, good. Well, why don't you tell us a little bit about ourselves, yourself, and, where you coming from?
I grew up here in Las Vegas. I was born in New York. My parents are from Pakistan. So my dad came over when there was a shortage of doctors in the U.S. And he did his internship in his med school out there, or did his internship and residency out there, did his fellowship in oncology in Salt Lake. And when he finished up in Salt Lake, he asked the chairman, all these cities in America look the same to me. Where should I go? And the chairman up there was like, hey, why don't you head down to Vegas? They don't have an oncologist yet.
Yeah.
So my dad came down here. He's the first oncologist in Las Vegas. And so he, saved a lot of lives out here. People are dying, 40, 50 from lung cancer and liver cancer because they smoke and drink themselves to death.
Yeah.
And so he did a lot to improve healthcare here in Southern Nevada. And he was on the board of medical examiners for a long time. So he helped up there too.
Yeah. How did that impact you growing up with your dad? I don't know how anyone takes a job where they have to constantly face a terminal illness in their patients. And that must have really developed some character in him. And you probably got a lot from that. What have you learned from watching somebody heroically go through that day after day after day, trying to save patients that don't necessarily want to save themselves?
What I saw was the hard work. I saw him, leave the house at 5:30 and coming home at 7:30 every day. And I saw that, he took care of his family and he made sure that we were, provided for and we had good values and, that we always did our best to do something when you had the opportunity to do something to help somebody.
Yeah.
I mean, lots and lots of people in the city helped when you could. And, have a responsibility to do what you can for their community, because the community was so good to my dad. And so he was, and my mom too. My mom, I think my dad, my dad, he knew coming into it that these people had a terminal illness. And so he was able to give a lot of people life back when they didn't have a chance at it.
Yeah.
My mom was a psychiatrist over here. And so here in Las Vegas, you got to see a lot of, I'm sure, very, very tough situations for people. And I never heard word one about it. Never once did, what I've known that's what my mom did if I didn't happen to know she was a psychiatrist.
Yeah.
Let me ask you something about the oncology issue, because that's sort of interesting. So one of the things we have going on right now is a huge debate. Of course, Nevada, scene of a lot of nuclear testing. So there's a lot of interest in particularly lung cancers, downwinder syndrome, radioactive dust. Did your dad see a lot of that?
I'd have to ask him. I'm sure that he would have seen those patients if they came through. And I'm sure some of them must have. But it's not a thing he ever brought up or talked about. I'd have to go back and ask him.
Yeah, I mean, that's something that's really only appeared in the literature. Of course, people knew it for years, but it's really only appeared in sort of the public consciousness over the last 10 or 15 years.
Sure.
Right. Interesting dynamic.
And they've been talking about it again because Trump just brought up wanting to restart nuclear testing here in Nevada. And there's a question of, to what degree is that can expose the public? And they say they have, done a tremendous amount to reduce the amount of exposure to the public. I think there's a less than 1% chance of exposure through the venting that they do for the testing now. So it's much safer than it used to be, but it's not zero risk.
Right. And then, of course, just here over the last couple of days, President Trump has come back and said he's talking more about mechanism testing than the actual explosion.
Oh, that's
right. You're right. So not the nuclear stuff, but it's going to be interesting to see how that develops.
That was interesting how that's reemerged. But, that's a pretty detailed part of this larger discussion, which is healthcare. And I love your upbringing with your parents, both being in the medical field. We have political issues in the country. We've got to have better policies and better infrastructure, but we have to have a better idea of where people are at psychologically and what's going on in their brains and bodies, and really get a robust healthcare system that works in place. And I feel like you have a perfect amount of exposure in all those different areas to be a very good representative, and especially for Nevada, but for the country in general. Is there anything, where do you want to start in terms of what are the issues in our health care system here in the country? What can we do to fix it?
Well, so I think the biggest issue is expense,
Mhm.
right? So the 60% of all bankruptcies are due to medical debt. I think that's a tremendous problem is the amount of waste that's going on in the healthcare system.
How did we get there?
So
Either one of you. Like, how did we get to this place where the rest of the world is far cheaper than us?
So what happened was in the 1980s and prior to the 1980s, healthcare was all operated by mutual insurance companies,
Mhm.
and people thought that that was the right way to structure insurance companies. That it was wrong to structure. And there were laws to prevent them from being structured as a for-profit entities. And that changed. The insurance agents or the insurance companies were able to lobby successfully to allow for a change to those laws. And in the 1980s, the when the hedge funds got access to derivatives, it dramatically expanded the amount of capital they had on hand. It multiplied their capital on hand, sometimes up to 50 times. And so they were able to go out across the country and start buying things up because they had this cash burning hole in their pocket. And so they would go to the.
It's like a bond, or their shares being purchased, or it's like it almost sounds like a bond, like a type of bond.
What is the best way to explain a derivative?
Well, a derivative, that, of course, the one example most people are familiar with is this is what happened in the housing market.
Mhm.
So it's almost a share might be a better description. So
Oh, a submarket.
yeah, it's a
Okay.
sub-market where, what happened in 2008 is that a lot of these hedge funds and other groups were buying a portion of a bundle of mortgages with the idea that home rights are going to go over, and then their investment in that bundle of mortgages,
Mhm.
which are derived from what the bank actually did, would then generate additional profit.
Okay,
So a stock is probably a better comparison, although it's not 100%.
so these are like healthcare mutual funds, and they kind of share all the risk. And
So what would happen because you had all the assets, the debt that was the first layer of loans to a certain amount of capital,
Uh-huh.
and then you would have people who could go get loans to buy bundled amounts of those assets, and then you could get people who could go get additional loans to buy an option or to buy or sell those options. So you have like 3, 4, 5, 6 layers of increasing amounts of debt to buy these collateralized obligations
Okay.
that are based on a small amount of capital to start with.
Okay.
And so you build these huge, gigantic amounts of leverage.
Okay. What ultimately broke that system?
Well, the underlying lack of value of the asset that they were based on. I mean, you saw it in the 1920s when they were allowing the banks to use stocks
Yes.
as the basis for their loan obligations, and then you had
The leverage buying.
the mortgages that were then used during the last debt crisis, the housing crisis. And so they argued that all of the home loans were insured, and therefore it was safe to trade. But there are only 3 companies in the country that were insuring all of the homes in that country, which is insane.
Right.
And so, I mean, it was obviously not going to be able to hold up. And for whatever reason, when we brought that to their attention, because we were part of it, I was on the board of a bank back in 06, 07. And when we went in front of the FDIC to do our bank training, we sort of brought this up. We said, look, what are you guys doing here? The average price of a home in Las Vegas is more than 3 times what the average person makes. So, and if you guys are going to approve, 4 more banks here, which is going to put at least $600 million more in assets onto the street, they are all going to be bidding on homes that are more in cost than the average person here can afford. So all of those loans are going to collapse. Why would you guys do this? And the person at the FDIC was, well, we have different data. I was like, come fly back to Las Vegas with me. We'll open up a newspaper and you can look at the prices and look what people are earning. It was
data.
So I don't know to what degree they just didn't want to look, didn't think to look, or that maybe they had some purpose in allowing things to go the way they did. That's not something I would have had access to know for sure.
So we're currently sitting in a government shutdown that is conceivably the end point of this story that we started to tell. So we had Obamacare that came in a little bit later. I'm sure there's something that happened in the Clinton administration, but this thing has just been patchworked the whole way. Is that essentially what's gone on?
Well, yeah. So Obamacare started with the idea that they wanted to hold insurance companies accountable. So when it was going through the Heritage Foundation, they wanted to take all of these complicated products that the insurance companies were selling and regulate them in a way that people could compare apples to apples when they were buying insurance. And they wanted to hold the insurance companies accountable for failing to provide care.
Mm-hmm.
So there were these ERISA laws that had been created that shield the insurance companies from liability when you buy your insurance through your employer. So 80% of the people in the country who have health insurance that's private, get it through their employer.
Mm-hmm.
When you buy the health insurance through your employer, the ERISA laws prevent you from suing your insurance company for bad faith. So if you had some terrible disease and they refused to provide you, they denied you care, you don't have the ability to sue them directly. It's very, very, very difficult.
Okay.
And so piercing those ERISA laws meant that essentially the insurance companies had very limited liability for inappropriately denying you care, and even if it led to your death. And so,
Go ahead. Yeah, sorry.
Well, I wanted to get on here because I think, and I actually disagree with Crystal, because I think a lot of countries actually do have real problems with their health care,
Okay.
right? Look what Great Britain's going through with NHS now, denial of cares and all this. But one of the things that always struck me is that the U.S. does differently is tying health insurance to employment, which is something we don't see in other countries.
Okay.
And that, of course, emerges after World War II, right? There's an effort to control prices because the war's over, consumer goods open up, inflation's out of control. So there's effort to control prices. So, the government steps in under the Truman administration, puts limits on wage growth, right? Which, of course, Nixon tried again in the early 70s. But so companies start offering health insurance as a way to attract workers when they can't raise wages. And then it becomes sort of normalized.
Mm-hmm.
Do you think we ought to decouple that? I mean, wasn't that part of the goal of Obamacare, was to be able to decouple employment from health insurance access?
it was one of the goals was to create that insurance market, and where you were buying the insurance directly from the insurance company rather than through your employer. And that would have given you a way to evade the ERISA laws. And when you evade the ERISA laws, suddenly the insurance companies are liable if they deny you care. But the insurance companies were awfully clever, and they spent an awful lot of money around the time that Obamacare was being put into place, and they were able to engineer things such that it ended up creating a huge transfer of wealth in this country to the insurance industry. To the point that in the 1980s, before we had all those changes, health insurance, health in America costs us 8% of gross domestic product. And today it costs 18% of gross domestic product. And we have a far worse outcome than we had back at that time. And it's because there are too many middlemen standing between the people who need the care and the people who provide the care. They're just all, have their claws in the system they're trying to pull.
Yeah. I see the same thing in the education system. We put more and more money into it, and the outcomes are getting worse and worse. So you can start to see patterns that anything basically the government gets its hands on tends to go inefficient,
People see gigantic piles of money and they start to figure out, how can I scam it? And if there's no direct accountability, if the people who are making the decisions can't be fired, well, then they're subject to bribery, manipulation, or influence from other mechanisms.
So
that's the danger of that
when
system.
Obamacare went through, I was in a place and time and thought where it was highly celebrated. And I couldn't see how it could possibly go wrong. Now I've learned quite a bit more, and I know a lot more about what the government can and can't deliver. I'm curious, you being in your field, when Obamacare was being passed, could you see it from the get-go that it was going to be a disaster?
Yeah, there was a really good article in the Wall Street Journal at the time that kind of outlined the way that it was going to fail.
Okay.
And they said what's going to happen is, and the thing that they focused on in the article was that up till that point, insurance companies, if they got $1 from the patient or from the person who's buying an insurance policy, they would keep 60 cents and spend 40 cents on actual care, and the 60 cents were on administrative costs. And so it was extreme. But in the Obamacare, they said, no, you have to spend 80% on actual care, and you can only keep 20%. Well, so all the insurance companies were up in arms. They're like, we're going to lose all our profits. And so they were very, very angry. And so the guy from the Wall Street Journal wrote, he says, well, so the insurance companies are just going to vertically integrate. They are going to buy the medical clinics and the hospitals and the equipment manufacturers and the pharmaceutical companies, and then they will just jack up the prices over there. And when they jack the prices up on that, then they'll be able to say, look, we spent 80%, but then they'll be able to, on the backside, take the money back out so that it becomes their profits. And that's basically what Optum is an engine for extracting profits from the transactions within healthcare. At least that's how it seems to me.
So if you saw it coming, here's a hard question to ask. Do you think the people that passed it, the Obamacare team, knew it was going to fail, or were they legitimately thinking this might work?
Well, I think there were people over there who thought it might work, and they said, okay, we're going to pass a flawed version now, and then we'll be able to kind of fix it as we go along. But what ended up happening is, as happens when you have the ability for these, very large entities to start to influence government and influence politicians and the decisions that they make, they were able to regularly and aggressively and steadily, get more and more and more laws passed in their favor until we are where we are now.
Yeah.
Where, kids like Luigi Mangione think the only option they have to hold these people accountable is to throw their lives away.
Forgot about that.
It's a terrible. I felt so ashamed. That's one of the reasons I'm running. Actually, I felt so ashamed that here was this young person who felt like the only option that was left to hold these people accountable was to go and do that. If, allegedly, this is what he did. And I felt like his elders failed him. I was like, I'm his elders. I mean, he's only doing this because his parents didn't get out there and step up, or not parents, people who are senior to him didn't solve the problem. And I was like, am I going to leave this to my kids? That's shameful.
So, how much do you think this is just an insurance problem? And this is something we've talked a lot about, the rural perspective, but one of the problems we've seen is actually a decay of infrastructure. So rural communities, we can't get doctors in. One of the things Obamacare seems to have done is by defraying the cost of transportation for insurance companies, right? Instead of getting another doctor or another specialist, say in Elko, the insurance company's like, it's just cheaper for us to make you go to Salt Lake or Reno or something.
So it is. It's so hard for us up north to get decent access to medical treatments or diagnoses. It's either Reno or Salt
Lake or Twin Falls for Elko. And one of the problems also is that we've also seen this situation where community-owned hospitals have largely disappeared. They're now owned by insurance companies, and they're like, well, we'll just fly you out somewhere. It's cheaper than us bringing a doctor in.
Well, and private equity has played a huge role in that, right? So private equity rolls in, and then they buy the thing up, and then the reason they're able to generate the capital to buy it up is because they loaded the entity with debt. And so on the day that the transaction takes place, all the original investors, get paid out of that debt. So their investment is totally covered. And now the hospital is left with a huge amount of debt that it can't possibly cover. These guys who sort of engineered the transaction know the hospital will fail, but the incentives in the structure were enough to make it profitable for them to bury these hospitals. And it's not just in healthcare this happens. It happens in many different industries. But it's a very sinister thing that's been going on throughout the country, and that's something that needs to be changed. Laws need to be passed to prevent that.
What about the counter argument that I have some friends from graduate school in particular to keep bringing up is that one of the problems we have with healthcare is that it's a finite resource. So no matter what you do, you have to make decisions and limit access somehow. Whether that's through, of course, one of the things came up thanks to Sarah Palin and the Obamacare, the death panel idea, or what we see going on in HS, or simply the fact that, it's increasingly impossible unless you're a big Salt Lake hospital to get the state-of-the-art MRIs and CAT scan machines and everything. Do you think that's playing a role as well, that we have too big of a demand and too limited of a supply?
So I think the problem is that there's a disconnect between the price of the good and the quality of the outcome. And the reason there's a disconnect is because the purchaser of the good or service is not the recipient of the good or service because of the way that insurance works. And that's the difference between the mutual insurance company model and the publicly traded model that we're in right now. So in the publicly traded model that we have right now, the incentives for the CEO of the publicly traded health insurance company are two. The first is that they have to go to every employer in the state and charge the absolute maximum amount of money that they can extract. And then the second is they need to provide as little care as possible. So to the extent that they succeed in both of those goals, they've maximized company profits, shareholder valuation, and their bonuses. But that's absolutely not aligned with the interest for the patients. In the 1980s, when we had the best healthcare in the world and it cost less than half of what it costs today, they were operated by mutual insurance companies. And the CEO of a mutual insurance company has to negotiate hard still with people like me in the hospitals, but there's no incentive to deny appropriate care. Because if they deny appropriate care, the people who own the company, the patients, the mutual insurance policyholders will fire them. So now the CEO's objective in that model and incentives are to provide the highest quality care for the lowest possible cost, which is exactly aligned with the incentives of the patients. So that's why this is a superior model for the people of the state of Nevada as compared to the publicly traded insurance. And what will happen if we set these up is that the hundreds of millions of dollars that are being siphoned out of Nevada go to Wall Street, to investors in China, Russia, Saudi Arabia, and the central banks of Europe. That money will instead stay right here in Nevada and recirculate in our own economy. That's a tremendous savings to our city, our state, our nation.
Can I continue this? Because there's one more aspect. I'm just throwing out, playing devil's advocate here.
Just like, how on earth could you, it would be so amazing if doctors only got paid based on outcomes, but there's just no way to measure that. Right?
No, there is.
Is there?
We're getting better.
Okay.
The best version of that is the physician-owned ACOs.
Okay.
So you have these accountable care organizations, and accountable care organizations were designed so that primary care doctors would take on some of the risk. And because they have control over who they send the referrals to, and they see the patients afterwards, so they know what the outcomes from all these other providers are, they have the ability to say, that guy's not doing good work, this guy's doing good work, and they will reorganize their patients in that fashion. And they had a really good one that was operating out of Michigan. Those guys came down here, gave a lecture. They were, Medicare's like, these guys are the best in the country at figuring this out. So the accountable care organizations that are operated by physicians have the appropriate incentive structure. The ones that are operated by insurance companies and hospitals, you can see how they'd be incentivized to drive them to the hospital or to provide no care at all.
Yeah.
But when it's the physicians, so they would have a management structure in these wherein when the physician was making a decision, and the decision was like, oh, I'm going to use this piece of instrumentation in the surgery, we're going to give these medications. The managers at the company would call the primary care doc and say, hey, your guy is about to do this incredibly expensive thing. You better call him and find out what his reason is, or tell him if there's no good reason, you need to tell him you're not going to refer any more patients to him.
Yeah.
And this is incredibly effective, and they have the greatest risk, the greatest cost reductions of any of the people out there doing this.
It's
really
funny.
good.
It's funny
Because you align incentives properly.
Right.
Yeah.
And it's funny that you mentioned primary care doctors, because that's where I was going, and this sort of fits into this. Some people have said one of the problems we have in the United States is it's not just the healthcare system, it's also the population. That what we do is because of demands of the population, we've created a health crisis management system, not a health care system, right? That people,
That would wait too long.
we wait too long to go to the doctor, the obesity levels, all this other stuff that's behind the MAHA movement. Do you think that plays a role? Because what you're talking about, one of the things with the lack of primary doctors, again, going back to rural communities, we don't have doctors that come out and establish practices anymore for whatever reason. And we're not alone in that. I mean, France went through this under Sarkozy's presidency, where he tried, since the state in France pays for medical training, to assign doctors to rural areas that didn't have them, and the medical unions fought him. And he ended up losing the battle. So you have some place like, I think, Montpellier down the Mediterranean coast has like one doctor for every 7 people. And half the doctors are on basically unemployment insurance because they can't get enough patients. But they can't redeploy them to sort of interior areas, or in the U.S. case, rural areas that actually need the health care and need the primary care. So if there's no primary care, your option is go to the emergency room, which is an incredible waste of resources, or wait until something has to be done because there's no other option. And all of a sudden you're not getting ahead of the game. You're just dealing with the consequences of bad choices.
Well,
So
and sorry, but to be fair, I think there's a little bit, you're kind of missing something just a little bit, because we do wait too long to get addressed, but we also have a lot of high levels of chronic illness, and that can do a lot of damage before you perceive it. And so
Right.
we're dealing with a lot higher levels of that going on too.
Mhm.
And it's more expensive to fix those things, because there's usually so many different modalities and things to try.
So there are two things to unpack from the statement that you made. The first is that the amount of time that people wait before they get care, sometimes that's got to do with just how high prices are, right? I mean, I know several people who have delayed care because it's going to be too expensive.
Mhm.
And then when they found out they had something serious, they just said, I'm not going to get it treated. I'm just going to let this kill me because I don't want to put this kind of debt on my family. I know at least 2 people like that, which is, that's awful. People are making decisions like that, right? And then, so one is just the incredible expense up front that's happening. And that's because there are these entities that, have so many layers of administration, and all those people are trying to get their claws in and take money out of the system. So I think if you remove all of those people, at least more of these people will be able to get access to more of the care, and the quality of the care will be higher because people have time to spend with them. And you'll be able to, reimburse enough that you can get people out to the rural areas again, because that's the goal, right? Or that would be a reasonable goal to have. I think the second issue that comes up with the way you put it was going back to the MAHA, was how do we make people healthier than they are? And so how do we start to ask questions about the standards that we have allowed to be put into place? And what we have seen, unfortunately, in this country is the wholesale capture of regulatory bodies by industry. And so these gigantic corporations have spent, 2 generations, 3 generations on hiring very, very expensive and high-priced and talented lobbyists to gradually chip away year after year a little bit more of getting the laws written in their favor. And so now the laws are written so heavily in favor of these gigantic corporations and against the people who live here and do the work, because who's been representing them? Almost nobody, right? Just, and it's certainly not in an organized fashion, certainly not in a well-funded fashion.
Right.
So it was on that basis that when we saw that this last year when I was when I was president of the Board of Medical Examiners, we were trying to get some laws passed to improve things, and we saw how almost all of the things that we recommended were just ignored. I started paying attention to how these laws getting passed, and we said, okay, this is how they're getting passed. So there are these very well-funded lobbyists from the insurance companies, the hospitals, and the hedge funds that practice medicine, the pharmaceutical companies, and they passed laws successfully that time, and then this last time, and they will next time, and then every year in the future from now for the next generation. And I thought, well, what are we going to do about that? Because the rest of us can't afford to work on this thing.
Right.
But I kind of came to the conclusion that there are 150,000 people in Nevada who work in healthcare. And that's 5% of our state's population. So if they all have a significant other, that's 10%. If they have one friend who cares about healthcare, that's 20%. And if only half the people show up to vote in an election cycle, that's 40% of the electorate. 40% of the electorate, we can get anybody elected anything.
Yeah.
So we created a loose affiliation of people. We called ourselves the Scrubs Party. So we're all Scrubs. And you know, because I was vice president of the board, I called the president of the nursing board and the dental board and the optometry board and the psychology board. There's about a dozen of these things.
Yeah.
And I was like, are you seeing the same problems? I was like, yeah, we're seeing the same problems. And they're so happy somebody's doing something right. One nurse breakdown crying. She's so excited somebody's fine. There's a lot of despair. In right. I mean, it's you know, there's a lot of people who, I explain it to lay people. It's like you're standing at the edge of a swimming pool and you see somebody drowning in front of you. And you really want to help them, right? That's natural human instinct. So you know how to help them. So in this case, what you do is you put your hand out to drag them out. But when you put your hand out, the insurance company, the hospital grabs you by the wrist, folds your arm behind your back, and they just stand there and watch them drown and die. And you know, you do that every day, 5 days, weeks, and you know, week after week, month after month. It breaks people. People are really in despair in medicine because they know what to do, and they are actively being prevented from doing it by hospitals. So one of the hospitals over here, best ICU doc at the hospital was highest survival rates. But high survival rates also meant your patients were staying in the hospital longest. So, you know, he fought hard for the first couple patients, first 10, first 20, but after that, the hospital's like, you're costing us money. If you continue this, we're going to throw you off staff. And if you're a doctor and you get thrown off staff, it affects your ability to practice anywhere else. And you can get thrown off all the insurance panels and you won't be able to practice anymore. So he said, I give up. I will no longer be an ICU specialist. I'll go back to being an anesthesiologist, which is what he did. He's a very good anesthesiologist. But the point is that you had the best, you know, the most successful doctor in that field chased out of the system because of the financial incentives that exist. And that shouldn't be the case.
And it's interesting you bring up the thing about that the lobbyists have figured out it's regulatory agencies. That's sort of the key, because this has been one of the discussions we've had that, at least my belief, is one of the things we've seen over the last 40 or 50 years is Congress stepping back and into the lacuna that Congress should be occupying making laws. We've seen extension of the judiciary, extension of the executive, and extension of the regulatory agencies who seem to
they're stretching
dictate.
to fill that void that Congress has left.
Right.
Yeah.
And, you know, one of the things you have a lot of these regulatory agencies that are de facto lawmakers now.
Yeah. So what happens is, I've seen this a couple of times here in Nevada. I got to serve on the governor's workforce board here for a while and the healthcare sector. And the person who ran that for the period of time I was there just refused to show us the budget. And I was like, well, we're signing off on the budget. It's your job to show this to us. And he was like, well, try and get me fired.
That's terrible.
Right. And he just refused. And it was stunned. When I was on the board of medical examiners, you know, at some level, there becomes a war between the executive team, the bureaucrats who are there, and the people who are supposed to regulate them. Because in their point of view, the people who have been elected or appointed to oversee them are temporary. And these people are there for the long term. So if they feed you partial information or stall everything whenever you make a request, they can outlast you. It's very hard to get all the information you need to regulate them. And then to know how to fight the fights that you need to, what tools you have to kind of, you know, break their will or break their ability to stop you. This is what Donald Trump went through in his first administration when the bureaucrats won, right? I mean, in many things. He did some absolutely amazing things for this country in his first term, but the bureaucrats were extraordinarily entrenched, and it was kind of a blessing, honestly. They had the next 4 years for the guys over at the Heritage Foundation to develop a plan. When he rolls in, this is what we're going to do to neutralize all of those people. And they've been able to execute on that. It's been fantastic for this country.
What about the argument that one of the ways to solve this, and this isn't a jab at you necessarily, but one of the ways to solve this is to see more medical professionals entering into politics and into legislative bodies? Because we've got two doctors now in Congress. There's a little bit more.
I think there might be more than that.
Right.
I can name. I know Rand Paul and Bill Frist, but I think there's 2 others.
Okay. So still 5 out of, even if it's 10 out of 535, they're underrepresented based on their proportion the healthcare industry plays in the United States.
It's an extraordinarily complex set of issues that are at play, and the insurance industry intentionally lobbies to try to make it more complicated because, you know, so that's the place in which people are able to generate profits is when people don't know what goes into the system. And if they can't, you know, clearly see what it is, if there's a obfuscation of information, then they're able to arbitrage that into higher prices. And that's the accountants do the same thing.
Right.
So they try to make the accounting rules more and more complicated. So you have to hire someone to just sift your way through it.
Yeah.
Or realtors, which we've talked about with the AI stuff.
Yeah. I'm curious how AI is going to play a role in the medical field. I was thinking they could clear up quite a bit of expenses.
You mentioned the NHS.
Right.
So Palantir got a contract for $300 million, I think it was, to run the to what the plan that I saw put forward is they want to create an AI that everyone who wants to utilize the National Health Services in England has to address like a Palm Pilot or a handheld AI. It's called My Companion.
Mm-hmm.
And so you ask that first, what's wrong and what you need done, and it will, give you some baseline medical answer.
Yeah.
And then based on that, you'll proceed into the system further or not.
Mm-hmm.
So you can imagine how that's going to play out. And I had this discussion at the Federation of State Medical Boards meeting, and it wasn't in Washington, but it was the national meeting. I think it was held in South Carolina. And there was a fellow who came down from DC and another fellow from Harvard, and they spent about 45 minutes telling us how smart they were and how they were going to, revolutionize healthcare and create all these AI protocols for everything. And when they were, done complimenting themselves for 45 minutes, I raised my hand and I was like, listen, so, I know you guys are very proud of the work that you've done, but the things that you're doing are going to destroy healthcare in this country. Because what's happening is there is a war going on in this country right now to decide who should stand at the center of deciding what good healthcare is.
Mm-hmm.
And the insurance companies want to stand there at that center. And if they win, then nobody will get any care and they'll keep all the money. The hospitals want to stand at the middle of that because if they get to stand there, then they'll have even fewer nurses and they'll replace all the doctors with PAs. And that's just what you get when you go. If the pharmaceutical companies win, well, then they're going to raise prices on all the newest drugs and prevent you from using any drugs that might save your life, like we saw happen during COVID, actually, right?
Yeah.
And they prevented people from using life-saving drugs. When if the hedge funds that practice medicine win, then you'll see even more rural hospitals and larger urban hospitals go out of business as they find ways to exploit the system. So, and the one person they're not listening to, right, are that group of people who are, carefully selected for integrity and competence and, have a personal stake in seeing patients get better and, like pride, if nothing else. And so those are the people who all of these other institutions want to denigrate because they say, those guys don't know what they're doing, trust us instead. So that's the war going on in this country. And when what I was telling these guys from DC and Harvard, I said, when you guys create your system, about 30 minutes after you've written your last line of code, the pharmaceutical industry or the hedge funds are going to come in and capture the regulatory body that's running your entity and rewrite all of your rules so that their version of healthcare, the insurance companies, no one will get any care, and they will just. And when you make this universal system all across America, what will happen is you are going to destroy the 50 different laboratories we have that are creating healthcare systems that uniquely address the people in their states and that are engines of innovation in our country.
Yeah.
Because every once in a while somebody comes up with something that seems to work better for everybody else. And they will crush all of that by creating this one unitized cookie cutter system for everybody. And I swear the both of those guys, when I was done talking, just sat there with their mouths hanging open.
Yeah.
I think nobody had ever bothered to criticize them or to make these things. I must have had a dozen people come up to me, people from all over the country, attorneys and doctors, like, hey, thank you so much for saying what you said, Dr. Nagy, because that is exactly what I just didn't have the words to articulate it.
Mm-hmm.
Well, and that's like the general problem too, is you'll always have a rich, powerful, very smart, tactile group of people that will figure out the loopholes. They'll figure out how to game the system no matter what. And it really does come down to having an educated, dedicated citizenship that can keep these people in line because they're so clever. I watch it in every single industry.
And one of the things that's terrible is when you have these institutions that get developed in order to provide that sort of regulatory oversight. So you have like the AMA or different organizations in different fields that are like that. You will see them get captured by government, not by government, but by very large institutions. They will just find all the people who are there and offer them very, lucrative contracts. And one by one, they will find a way to either influence the people who are in leadership or find a way to replace them with people who are more easy to influence. Yeah. And so over the course of, a dozen years, they will have control of that entity and all of its policies. And it's upsetting because these are the entities that you want to see protecting you.
Surviving.
But this is the reason that so much has happened, that the standards that are in place now that the MAHA movement is trying to undo, this is how they got there in the first place, that these giant companies acting in their own best interest, as you know, can you fault them for acting in their own best interest? Maybe not. But the end result of that is that the people who are supposed to be holding them accountable have no longer been able to maintain that ability to hold them accountable. So what has to happen is there has to be sort of a continuous, and we have to, commit as a society understanding, there has to be a continuous upheaval in the oversight of these organizations. These organizations are providing oversight, need to sunset, and new leadership needs to come in. And this is how we keep things honest.
Yeah.
Going back to the educated citizenry, and we touched briefly on COVID, but this is also an interesting question because I think one of the things that's allowing, pharmaceutical companies and insurance companies and in some sense the medical profession is this veil that they put over the knowledge. right? That we know what's going on, and you people who claim that ivermectin or I never can pronounce it.
Ivermectin, the controversy.
Yeah, the controversy over that was like, well, you're not a medical professional, so you have no say in this. And turned out they were actually right. Yeah, I mean, how do we solve that issue?
Well, so they were very effective in silencing the medical professionals. So I mean, I think it was at Parkland in Dallas. They had 400 physicians who signed a paper that ivermectin, Plaquenil, or hydroxychloroquine were effective and should be able to be utilized. The person who sponsored it was a Harvard-trained rheumatologist, as I recall. And they were able to be demonized by a tactic wherein somebody else sort of joined their movement, and somehow when the cameras showed up, she was the person who was in front of the cameras. And the day after she was in front of the cameras, turned out she was like a Satanist and believed in aliens, and they were able to discredit the entirety of the movement. Now, maybe that was all randomly happened by accident, or maybe it was a planned sabotage of the movement intended to discredit them. We found a generic drug that was curing patients with COVID. So not ivermectin or hydroxychloroquine, it's called dronabinol. It was saving lives here. We had a 68% reduction in mortality, a 37% reduction in length of hospital stay in patients who were on oxygen fighting for their lives against COVID.
Yeah.
And we had countless people attacking us. And when we sort of brought this out into we kind of put the paper together, presented over to the Clark County Medical Society, and we were attacked. Just kind of like, this is unethical to this. How's it unethical to try to save lives? They said it's they were wrong, 100% wrong in the attack they used. They said, oh, it's not statistically significant. Well, they used the wrong tool. Yeah. So I took this as an intentional attack. And then the guy who was the dean of medical school at the time, was going around the state telling people, I'm at war with Dr. Nagy. I never met this guy, I never heard this guy, I never talked to him. He's at war with me apparently because what? Because we found a generic drug that's saving people's lives in the hospitals. And so about 2 months later, they pulled the drug. The hospitals wouldn't let us provide it anymore. And so the doctors who were giving it were like, these patients right now are going to die if you take them off this drug. And they took them off the drug anyway, and they banned its use. And I can't, for the longest time, they gave us no explanation. I couldn't figure out why. And within this last year, I started to understand just how much money the hospitals were making on utilizing remdesivir and on really letting these people die. The worst offender, in my opinion, was over at UMC. UMC here in Southern Nevada has been running in the red for a generation or two, right? During Obamacare, they were in the black for a little while. But I went over there and took the data that we had. I said, look, would you try this on these patients here at the county hospital? Try it on a couple of people, start to save lives, and then we'll be able to save more. And they were in the space of 45 minutes. They managed to ask me 9 times, but who's going to pay for the study? I was like, what are you talking about? Pay for the study? It's a generic drug. Use this drug. It's going to save lives. This is what you do. This is what your purpose is. Why everybody pays you taxes. Save the lives of the people who live here. But they were more concerned with how much money they were going to make and how much. And I didn't know until this year that the CEO's bonuses were dependent on the fiscal performance of the hospital. So apparently, it appears, based on that information, that he was willing to let people die to make sure he got a profit. And that, if that's true, that fills me with the kind of rage that I find hard to articulate.
And this is UMC just got. We had another big controversy you guys did down here in Vegas. The city council giving him. Weren't they the ones that got the bonus?
Yeah, they fired a bunch of nurses and then gave him a huge bonus. And you're just kind of like, what are you doing? We already have a nursing shortage. They say nursing shortage over here, but this is another interesting thing, right? So they say, oh, we have a nursing shortage. They have a shortage of nurses willing to work at this dollar amount. During the pandemic, they were, they just about doubled it, right? And they had plenty of nurses during that period of time because when they were willing to pay a competitive wage to compete with the rest of the country and the salaries nurses are making across the country, they were able to attract nurses. So they have a shortage for the price they're willing to pay.
Right.
And that's, that's allowed. So they are therefore allowed to put their profits ahead of the lives of your children, your family members, your loved your friends. And
I mean, like I said, I'm very upset about the COVID response, but it feels like to me everyone's forgotten about it and it's in the rearview mirror. So to me, the whole thing could happen again.
Yeah.
With no stops.
I've had people sort of, 2 people now tell me that very clearly they believe that there is another pandemic coming in. Of the type more like Ebola or Mars or something like that.
Great.
And that's it was quite shocking to hear that they sort of asserted that with such confidence. And there were people who sort of out of Washington, and so that was a little disturbing.
More alluding to like COVID was a test run of some sort.
I don't know about the test run. I do know that the U.S. government spent money on creating a biological weapon, and the biological weapon was unfortunately used on the people that was apparently the people of the United States of America unfortunately suffered at the hands of that biological weapon. And then they were prevented from utilizing drugs that were effective against treating it. And then, so that's, denial of life. And then they were forced to get vaccines and forced to get masked up if they wanted to keep their jobs or wanted to participate in the economy. So that was a loss of liberty. And then They were prevented from, engaging in gatherings with their friends and family or places of worship. So denied the pursuit of happiness.
Mm-hmm.
And, the Declaration of Independence takes some time to define what a tyranny is.
Yeah.
And, loss of life, liberty, pursuit of happiness, well, that's a tyranny, and it's appropriate for people to rise up against a government that side.
Mm-hmm.
So it's terrible that people were able to take control of levels of our government and use our government against us.
And so many people died alone.
Yeah.
Which is, I think, most of our biggest fears. And it's just, can't go in and say goodbye. Like, geez, there's so many things that happen there that I'm like, oh, are we going to have any checks in the future? If this is there anything that can be done once you get into the House of Representatives?
So the question is I believe there were a set of arguments being put forward that it was anti-American to put forward a treatment for COVID, and the rationale on that goes as follows. So if you're the president of the United States, there are times when you will be asked, do we need to go to war? And when you make the decision that we need to go to war, you have made the decision that there are a certain number of Americans who are going to die in pursuit of the national interest. And that's, an incredibly tough decision.
Yeah.
And, you have to have a lot of respect for people who make it, but they have made this decision in the past that sometimes the national interest is worth that. What is the national interest, though? I always ask myself, what does this mean, this term national interest? So I think that it has two parts. The first part to the definition of national interest is protection of American life and property.
Mm-hmm.
So when there's American lives at stake, we'll go send troops out there to go defend them, rescue them. When they're giant corporate interests, we'll go out there and we'll defend the land or corporate property and protect that. But
the economy.
Well, and that's the second part. The second part is the transfer of assets under foreign control into American control, and so that's things we do for oil or for other natural resources or for other. So there's a question then. If there was this disease and the only way for people to live was to pay for every man, woman, and child on the planet who wanted to survive, what the means to pay to purchase this vaccine, and that was going to be a transfer of a tremendous amount of wealth into the American economy, and that anybody who was standing in the way of that was in some way doing something against the national interest. And I think there were a set of people who believed this to be true.
Yeah.
So when engaging with those people, you had to be very careful to structure any argument that you put forward in terms of a treatment or a therapy that it was also in the national interest and that it would be something that would work alongside the this other vaccine and not in opposition to it. And so to the extent that there are people who think that trading hundreds of thousands of American lives was worth that kind of thing, if such people existed, I think that that's incredibly evil. And I think the intent to suppress the ability to treat American lives, to threaten, I talked to professors at institutions. One of the people was the former chairman of one of the most prestigious immunology programs in the country. He was afraid to on record say anything against Anthony Fauci because Anthony Fauci was director of the NIH and the NIAID and could therefore threaten the funding for all of their future projects, basically eliminating everyone's career. And so the entirety of academia who wanted to protect their careers or who thought that their career was worth more than the small chance their voice might have to derail this procession were coerced into silence. And those people who spoke out did have their careers ruined and destroyed. And hats off to people who had that kind of courage.
Yeah.
I was here. I got to protect a lot of people because I was on the board of medical examiners. So, doctors here who were afraid that if they prescribed ivermectin or hydroxychloroquine, when they were told that people were going to take their license away, I told not as long as I'm here on the board. And I was able to hold good on that. We didn't go after anybody for that, as long as they had rationale for what they were doing.
Was that under Sisolak?
Partly under Sisolak and partly under, I guess it was all, the COVID was pretty much wound up by the time Lombardo came on board. But when Lombardo was on board, we had the issue with the vaccines. So by then I had started to receive a lot of reports, my so-and-so, died or got sick or had a terrible response to this vaccine. I think the vaccine's sick. And, a lot of it I kind of just had to take with a grain of salt because I didn't have anything hard evidence proving that there was some problem. Until somebody sent me the video created by a guy named Philip Buchholz, who was a biochemist from South Carolina. And he had the good sense to present his data to the state legislature. And it therefore becomes part of the state record, and it's hard for people to delete that and take it off the internet. And so he said, look, I got some of the vaccine samples from Moderna and from Pfizer. And we ran a PCR expansion, which is just kind of my job. That's what I do every day for different things. So I did it for this. And it turns out, in addition to the mRNA inside the lipid nanovesicles, there's also DNA. And if the lipid nanovesicles fuse with your cells, they will push that DNA into your cells along with the mRNA. And there's some chance that that DNA jumps into your own genome. And if it jumps into your own genome, then it can cause either proteins to misfold or it can cause them to malfunction. And if they misfold, that can cause autoimmune reactions or potentially. And if they fail to function properly, say it's a tumor suppressor gene and that one fails to function properly, now you're at risk for cancers. And so I took about 2 months to sort of study this and find some flaw with it, and I couldn't find a flaw with his reasoning. So I wrote to the FDA, President of the Board of Medical Examiners, and this is, the questions that people are putting to me, and can you please provide me evidence that will allow me to allay the fears of the people in the state? And I'm very respectful. And they sent me back a response as, oh, well, we're sure you've already read what we sent to Joe Lopato. And I had to look up who Joe Lopato was. He's a Surgeon General for Florida. He's been a very vocal critic of the vaccine. And so they said, we're sure you're aware of this, but here's why what you said is preposterous. And they sent me their reasons. And so I went through their reasons, and they were all terrible reasons.
Yeah.
The first one was that this can't possibly happen, and here's a paper to prove it. And the paper they sent was, from 2004. I said, well, here are 4 papers from the last 3 years that say the opposite of that. Are these relevant at all? And then they said, well, we did everything in accordance with vaccine manufacturing standards. I said, okay, well, vaccine manufacturing standards were year 2010. mRNA vaccines were invented in the year 2014, and they work by such different mechanisms of action. How can you propose that those are valid in any way? And then they said, well, here's the list of 30 PhDs who signed off on the inspection of the site where they're doing the manufacturing.
Yeah.
And they said, it's fine, but we had just gone through the process of submitting an approval for a drug product to the FDA, and so I knew all those steps. So I just went through and I was like, okay. And so I said, but they didn't do this here, and how come about this? And what about it? I can share that with you if you want the response I sent to the FDA. And I was like, and when it got down to the vaccine adverse report, so they skipped a lot of steps they should have, and it's not clear why they were allowed to do so. And they got down to the vaccine adverse reporting schedule. And it was like, well, you guys have here that 1 in 7,000 people who gets vaccine has a myocardial event. And the rate of, dying from COVID, even if you're caught it, is less than that. So how are you arguing that people should be taking this vaccine if the risk of harm from the vaccine is greater than the risk of harm from the disease? And they just didn't respond to me. So
I wouldn't either.
So I waited 2 months. There was no response. So then I sort of, wrote to the Clark County Medical Society again and to the governor's office, like, look, we need to, halt the use of the vaccine in our state until we can duplicate the study done by Philip Buchholz, and we'll have UNR and UNLV and Turo and Roseman and DRI, I think it was, collaborate to build a protocol that we'll use to, test this. And then we'll have, 2 of them run the protocol, 3 of them judge. And if they believe it was run correctly, then we'll know for sure. And then we can say, look, this is not safer to say, do something rational. And, I didn't get a response back.
No time to do a proper trial, that's for sure.
Well, there was time. It's a simple thing to do.
Is it?
To do that study, it would take 3 weeks.
Okay.
3 weeks, yeah.
So the mRNA, is that, if I understand it correctly, it carries a chunk of a genetic code and it replaces, or how does that work exactly?
So in the nucleus of your cell, you have all of your DNA, and then your body from that DNA creates messenger RNA that leaves the nucleus and goes into the cytoplasm. And from the mRNA, it prints off a list of amino acids into a protein, and those proteins fold up into all of the things proteins do. So this mRNA is the messenger, as like an intermediary. And so the plan was to push mRNA into your cells, and that mRNA would just it would get printed, and then it would sort of get dissolved the way that mRNA tends to get dissolved. And they did some special things to the mRNA to make it last longer. They didn't think it was going to last 6 months, or which is what they were finding. And they didn't have a good analysis done on how long these nanovesicles will stay within the circulatory system or how they're going to be disposed of.
Was it genetic code from the virus so that the immune system could?
Yeah. So the proteins that were being printed were proteins that were printed from the virus, the spike protein.
Okay.
And the spike protein itself, unfortunately, has a lot of negative things that it does to your immune system. It looks like, and that was a problem.
It's engineered that way.
It looks like that. Yeah, it looks like that. And so, there are a lot of really horrible things about the whole system.
Yeah, I called it a Frankenstein virus just because of the way the symptoms presented. I was like, this is chopped up pieces of different viruses. There's no one virus that naturally works like this.
And there's a gentleman out of Oxford who published that, right? He was like, look, it's like a 1 in a million or 1 in 10 million chance that this could have happened by happenstance. And that's that was quite concerning.
So looking forward, and this is sort of aligning information. Here you are running for Congress. What's some of your solutions to solve some of this stuff?
Well, right now, I'm extraordinarily happy that Donald Trump has picked RFK to sit on top of these things. I think he's asking reasonable questions. He's just saying, let's look, and with the vaccines, he's like, let's find out what's safe and what's not. If they're not safe, then let's make a change. If there are other countries that have vaccine schedules that are safer, or then let's adopt those. And so we're going to do those studies, and we're going to get to the bottom of things. We're going to find out. He's willing to look at the things that are approved by the FDA in terms of the what we think is good nutrition for our country. And if we're going to make our country healthier, maybe it starts with putting healthier food in. We're working on that here in Las Vegas for the last 2 years. It's Nevada Nutrition Coalition.
Right.
We kind of thought here in Las Vegas, we have the best chefs in the world. We have the freshest food shipped in every morning. We have some of the best nutritionists at the UFC and the NFL and the NHL and WNBA. We have all the tools we need to make the most nutritious, delicious foods for our kids in our schools. And if in 2 years we can prove that reduced obesity and reduced diabetes and reduced long-term health problems and improved athletic performance and academic performance and reduced mood disorders, reduced suicides and school violence and school shootings and teacher assaults, if we can prove that, then 49 other states in the country are going to want to be, hey, we want what they did. And so all the people who are providing those food products and the consulting for it and these kinds of things will have a market that bring a lot of money to Nevada, hopefully.
Yeah.
So, and that's all without raising a dime in taxes, right? You just kind of improved everything because it self-funds through the way
It's a
we
very
pay for it.
democratic idea.
Well, yeah, it's a very Republican.
Well, any final words for our audience, or?
Yeah, vote for me. Help me raise funds for running a campaign against Susie Lee. She's got $6 million, so it's going to take a minute to beat her.
Whoa, that's a big war chest.
Yeah. So, the campaigns are different than they used to be. So if you want to go ahead and get a hold of Dr. Nagy, we'll put his campaign stuff up on our website and through our social media. If you have questions for us or comments on this discussion, go ahead and reach out to info@775alive.com. But until then, I'm Scott Gaworski.
I'm Crystal Newton.
And we'll see you around the 775.
Yeah, thanks so much for letting me be here today.
Yeah.
Thank you.
Thank you for coming.